welcome to HFS Unfiltered. I'm Joel Martin, Executive Research Leader here at HFS, and I look after our application data modernization services. Today we're talking about deploying SaaS to deliver successful outcomes in healthcare. Now, we just recently completed a very large study looking at the adoption of SaaS to service business in their core application space. When you move systems to the cloud, you can't flip the switch and just call it a day. Getting long-term value from your investments requires ongoing evolution beyond just the implementation efforts you've gone through. It means keeping up with the rapid innovation cycles of those SaaS providers, adopting their releases far beyond just the basics around security and user interface improvements. But they're still missing out on many of the other industry, domain, and role-based functionality improvements that SaaS vendors are rolling out. And finally, both business and IT respondents were very clear that in their adoption of SaaS, they are driving a better employee experience. In fact, there are 7 areas of missed opportunities that we identified in our study with KPMG. These included automation improvements, a miss out on integration with new tools and emerging technologies, improving some of the security at the edge of the solution to ensure this new virtual workforce is not only getting value, but doing it in a way that secures the enterprise and reduces risk, reducing redundant software to optimize their costs and investments, improving IT's agility to react and respond. Joining me today are Josh Zalen, Vice President, IT Service Operations at Independent Health, Viktor Reznicek, Principal and KPMG's Workday Healthcare Leader, and Rohan Kulkarni, Practice Leader here at HFS. So with that, let's start a discussion, guys. Hi, guys. Great to see you here today. Josh, what are the important technology challenges facing health plans and healthcare providers? Maybe you can introduce yourself and Independent Health and tell us a little bit about your organization.
Absolutely, Joel. Independent Health is a not-for-profit health payer based in Western New York. We've got about 350,000 members. We cover all lines of business, and our mission is to improve the health and wellness of our local community. And we really, a lot of companies have lofty mission statements. But one of the things that I just love about working at Independent Health is it's real. Every day, all of us really focus on what we can do to improve our local community. And that's a big part of our jobs. And my job, which is to run our IT operations and ensure that we've got a stable environment, is a big component for how we are able to support the community. So when you ask what are the important technology challenges facing independent health or facing health plans and healthcare providers today, well, it really comes down for us and for our provider partners to how do we keep up with the pace of technological change? That change is just so fast and let's say fast and furious for the fun of it. And it's a huge challenge when you're dealing on the provider side with 0 or negative margins and on the payer side with 0 or just barely above 0 margins. How do you keep up? How do you cover the cost? And you layer on top of that fast changing government regulations and high cost government regulations, not just from the federal government, but from the state as well. And it makes it extremely challenging from a payer and from a provider perspective to keep up.
Victor, you bring a unique view to this coming from KPMG, working with healthcare plans and providers. What other challenges do you see out there?
Yeah, it's endemic for sure. So I have responsibility for Workday implementation in the healthcare space at KPMG. We've had the privilege of serving more than 30 healthcare clients, helping them transform their back office, finance, supply chain, IT, using ERP as an enabler. Last couple of years, about a third of all the providers in the US had negative operating margins. We see many organizations looking for ways to drive down their operating costs, also creating scale for future growth. But, operating cost is one driver, but it's not the only driver. The other drivers include being able to harness the data that they have in their front office, EMR, in their timekeeping system, and how to bring all that data to tell a better story around how to best serve patients and still break even at least. And connecting the dots across those data sets is another very important objective.
And maybe we just layer in just one more piece over exactly what Victor said, which is not just the data within the provider, but then between payer and provider, how do we share the interoperability aspect? And that's a big challenge that both parties are trying to address.
Yeah, Rohan, you've done some research looking at that.
So let me break them up between health plans and providers, right? I think from a health plan standpoint, a key barrier is the fact that there's just too much technologies, right? There are too many different applications. Consequently, there's a lot of tech debt. And part of the reason there's tech debt is because there's process debt. We're looking at 40, 50-year-old value chain that is primed for re-engineering that hasn't happened yet, right? And that has a downstream impact on technology. And then the last piece I'll call out for health plans is just the speed to deploying, right? Everything takes a very long time, and primarily it takes a long time because there's a lot of regulations and compliance that need to be met. Different clients require different things going in there that requires enormous amount of customization. So those are some of the things that I'll add to what Victor and Josh said. And then from a provider standpoint, really, my general view is that technology just grew really fast for healthcare providers. One day they had no technology, and then all of a sudden the next day there are too many technologies. And one of the challenges that has happened is, as a consequence of that, is in the U.S. today, we have about 6,000 different hospitals, behavioral as well as acute care settings, about 1 million or so beds. Each acute care bed has about 15 different devices that are connected to each other. Consequently, security is a huge, huge issue for providers because there are all kinds of bad actors out there.
Victor, Rohan brought up some great points: data, security, and legacy. As KPMG has a managed services practice in this space, what are your views in terms of how SaaS is helping basically reduce some of those challenges that Rohan just spoke about?
Yeah, honestly, there are many different ways, but the importance of being able to drive down operating costs, and that is one big reason that organizations are adopting SaaS. It's cheaper to run. You don't need the same size legacy IT organization to not only deploy, but to maintain and manage and support the infrastructure. The second is, frankly, the overall user experience, the overall value of that tool to the organization is increased. Every 6 months, sometimes faster, are releasing new functionality, and they're listening to their customers and incorporating that feedback in new enhancements, 30, 40, 50 enhancements. So cheaper, better, more secure is the third very important reason that organizations are moving to SaaS.
And Josh, how are you adopting SaaS at Independent Health?
It depends for us as a not-profit health payer. So maybe we'll start with cheaper. We're frequently finding that the SaaS cost relative to the on-prem cost is usually higher if you just look at licensing cost, perhaps, or the maintenance cost. But if you take into account the administrative cost of managing that on-premise system, basically the total cost of ownership, that's when you start to see that cheaper. If you look at maybe the total return on investment in terms of the other benefits that you get from SaaS, it's still worth it. When it comes to this SaaS software, we are almost always seeing a much better solution over time compared to our on-premise. So mostly for us, that's because on-premise, if we're lucky, maybe we can do 2 major upgrades a year. But to Victor's point, when you're in a SaaS solution, you're often getting 60, 70, 80, 90 updates in a month. And that comes back to my earlier comment about the importance of speed to market. It's very hard for a small health plan with no margin to keep up with the pace of technological change. And the democratization of data, the value of taking basically away from IT, that intermediary step where, I need a report or a dashboard, I got to go to IT, and then they have to make sure they have the capacity to actually do the work, and then they deliver it back, and there's a mismatch between requirements and what was delivered. That's gone, right? The business can go right ahead and start creating their dashboards. But what we do see is maybe competition might be an interesting word, because we may have more than one tool that produces dashboards or results. And sometimes you can get, I don't know if it's turf wars so much as competing reports that might offer different perspectives. And I think probably the larger the organization, maybe the more intense those competitions become. Lastly, you mentioned, Victor, freeing up of clinicians to operate at the top of their top of their game, the administrivia. And although absolutely one of the most important benefits that we get from technology, or typically one of the things we're looking at when we're investing in technology, is are we freeing people up from that administrative work so that they can focus on what we might call head work, or the type of strategic thinking that's required day to day.
It's hard for an IT organization within a healthcare plan or provider to keep up with all these changes and all the demands, whether they're security, usability. Back to my readiness comment. This is where having a partner on the managed services side is really essential to that. Having a trusted partner who understands your risk profile, your configuration, your dependencies is really an opportunity for them to step up and work collaboratively with you. Victor, a couple of comments from your experience.
Yeah, I appreciate the question, because it really highlights a very important point that I think everybody knows, especially those that have implemented SaaS recently, and that is turning on the new functionality by itself is not a silver bullet. And all of a sudden, self-service adoption goes up and people's ability to make better decisions increases, and your operating costs magically disappear. It takes a very intentional effort to take advantage of the functionality in the software. You're changing how the work gets done, what we like to call the service delivery model. You're changing people's roles, definitely changing the processes, right? You're introducing leading practice through the technology. We think that is absolutely essential to getting the value. A number of our clients have come to us after they've just sort of plugged in the new technology, and then they're standing in front of their board the next year and having to explain why all the outcomes that they had promised in the business case, why they're not realized. The reason is because they didn't design out the work. They didn't design in the insights and the improvements that they had promised. I would say that that's maybe the single most important place to start in terms of having the right partner, someone who knows how to do that, someone who's bringing leading practices from a bunch of other implementations and a lot of industry experience in healthcare. But I'd like to get Josh's perspective on what it takes to sustain the improvements, not just build them in for the go live.
This will come back to you, Josh, but Rohan, we've really drilled into and picked apart the opportunities that are needed for both managed service providers like KPMG and actual providers of the solutions like Independent Health. And throughout the conversation already with Josh and Victor, I heard a lot about two aspects of the triple aim. Reducing costs being probably the biggest one that we've talked about. Tell me this, though. Can you expand on what your research is showing about what's driving better experiences?
So let me just first frame the triple aim of care so that we're thinking about it consistently. So the triple aim of care is a framework that we use in healthcare, sort of measure the efficacy of delivery of healthcare. With some goals sort of built into it, which is one, the reduction of cost of care, and two is to improve the experience of care, and three is to improve the health outcomes as a consequence. Now, the study that you alluded to earlier, the respondents typically have gone towards, at length to describe that the SaaS in general costs less. Having managed care operators and other partners doing this typically will cost less than doing it themselves. That's sort of the top of the charts. The second thing that I've seen is also around security and resilience, operational resilience. Both of them, in terms of the impact of that, typically will impact the experience of care, because when you have operational resilience and when you have security, that also suggests that patients and members have access to their resources, have access to their services in a much more secure and a faster manner. And then the third element around there that we've seen in the study is around the increased responsiveness to market changes. One of the things that I'll call out is that in the US, the cost of the health outcomes have been deteriorating at a rather rapid pace. Our life expectancy in America has now regressed back to 1996. From a chronic condition standpoint, 6 out of 10 Americans have one or more chronic conditions. So overall, the health of the population continues to decline. And so while the technology itself will not make our improve our health outcomes per se, it certainly sets up the framework in order to facilitate and enable clinicians to be able to address the growing healthcare challenges that we have. At the end of the day, their core expertise is not technologies. Their core expertise is ensuring that their members are provided the right kind of care at the right time through the right modality.
Yeah, so I think Rohan and Viktor both raised really good points there. Maybe I'll just think about some specific examples. We've had SaaS implementations where we did it ourselves with the SaaS vendor. We've had SaaS implementations where we had a partner like a KPMG help us. In both cases, we've had those go well, and in both cases, we've had those go poorly. And so when we step back and we think about, well, what are the preconditions that help to ensure success of a SaaS implementation, whether with a partner or without a partner, it really goes to Viktor's point around, is the organization ready to change, and are they spending the right amount of time on design? And have we spoken and discussed what it looks like after implementation? And if you do spend that time, and if you have an agreement on what post-implementation maintenance, support, and operations look like, you're much likelier to succeed as a customer. And there's some software that's just so complex and so different for an organization that we couldn't possibly do it without a partner. And oftentimes the SaaS vendor will come out and say, our product is great, but we're not experts at implementing it, or we're not experts at changing how you operate. And it's in those cases, especially when we look to a third party like a KPMG to come in and help us through that journey. But it's also incumbent on us to have an appropriate RFP or appropriate due diligence where we're discussing whether we're discussing with all the potential partners, what does design look like? How will they take us through that exercise? What does post-implementation look like? How will they take us through that best practices exercise? And are they going to keep it, or are they going to hand it back to us? And if there's a knowledge transfer, how do they do that? And does it make sense in our context? And to Rohan's point, we can't just implement software. Like you don't just implement software. You implement a benefit for either your organization or hopefully more directly to your members or to your patients. How will the partner help us understand whether or not we are achieving that benefit or will achieve those benefits? And if we're not going to, help us pivot quickly.
I can't agree any more with that. I just want to build on it, if I may. That is the whole point of making a change in SaaS, is to affect business outcomes.
Rohan, maybe you can close us out with some thoughts on where you're seeing innovation in healthcare along the triple aim, and based on some of the conversations we've heard from Josh and Viktor so far.
Absolutely. So let me call out three things. I believe that SaaS can help with the interoperability challenges that we have across the entire healthcare ecosystem. One of the biggest challenges that we have in healthcare is that systems don't talk to each other. We really don't have a good understanding or a 360-degree view of that health consumer, whether the consumer is healthy or a patient. We just don't have a full understanding of that. And we're seeing as a consequence of that, the efficacy of treatments, the health outcomes, and so on, right? So my general sense is SaaS applications are driving a level of standardization, will essentially help address some of the interoperability challenges that we have. The second thing I would call out is the fact that health plans as well as providers with SaaS are going to be in a much better situation to deploy their capital. They can take out the capital intensive aspects of their business out of the equation from a technology standpoint and leverage those capitals for other things that will truly help their members, will truly help their patients. And the last thing I will call out is, generally speaking, right, SaaS will help you go to market faster. Go to market faster in healthcare would mean that you can get to a patient, can get to a member and address their challenges and their issues a whole lot faster than you trying to build those systems on your own.
Thank you, Rohan. Thank you, Viktor. Thank you, Josh. This has been a great conversation. I really appreciate your time and the insights that you shared from an analyst, from a practitioner, and of course, as a consumer of all of these services to deliver to your own clients and patients.